Hi, welcome to another COVID-19 live update. With me is Garfield County Health Department, and it is Community Engagement and Planning Director Maggie Johnson and Health Educator Ray Johnson. Ladies, thank you for joining us.
Thanks, Anna. Hi, Enid.
Can you ladies give us an update of the executive report and the number of COVID-19 cases in Garfield County?
Sure. So for the state, we have 3,748 cases. There have been 230 deaths, and 2,467 of those cases are recovered. So that brings us for the state 1,051 active cases. For Garfield, there have been 17 total, 15 for Enid, 1 death, which was in Enid, 8 recovered for the county, so 6 recovered for Enid. Update on that.
Now, today is the first day of phase 1 of Mayor Pankinen's reopening Enid's economy. You guys had created a Facebook page for businesses to help them, give them guidance and relay some important information that they can use at their business, correct? Can you tell us a little bit more about that?
Sure. So we created a Facebook group called Northwest. It's NWOK Healthy Businesses. And it's just a social learning Facebook group that people can go to. It has units broken down by restaurants, barbershops. Businesses can join it. Anyone can join it and go and get guidance on how to disinfect, EPA approved disinfectants, some tips on social distancing, graphics, and things that they can use in their windows in their businesses, some guidance on cloth face coverings. And we are always open and looking for suggestions. So if people have questions about things they want added to the group, please reach out. I'm more than happy to get that information and share it.
Now, you had posted on your Facebook a couple of pictures that there is being LTC facilities being tested for COVID-19. Can you tell me more about that?
Sure. So I think we can share that the governor has tasked the health departments with testing every single long-term care facility in the state. That was this week. So between Wednesday and Thursday, we tested 351 employees and residents of a long-term care facility in Enid. For our district, we are starting with Enid, so we'll Enid and Garfield County will test all those facilities in the next week or two, and then move on from the district for that.
Now, can you tell us the numbers of how many tests you guys project to test just within the LTC facilities?
So, like Ray said, it was 219 staff, 131 residents, and we will continue at that pace depending on the size of the facility. Total, that means for the Garfield County Health Department, we've done 732 tests total in just Garfield County out of the county health department. And, that's just in addition to what the hospitals and the healthcare providers are doing. So it's a relief to know that we have supplies now. In the long-term care facilities, we're using a saliva test. That's been a little bit easier for the patients there to, some of them to do. Then we also have the nasal swabs like we do at the health department. This is the saliva test we're just utilizing at the long-term care facilities. They're going to a lab in Texas, so we're anxious to hear the results soon.
Now, does Garfield County specifically in your clinic, now it's always been open, but are you collaborating with any other businesses? I know you created that Facebook page that you shared with us, but are you a lot of businesses that we have encountered and kind of reached out to are cautious and are not opening their doors yet, probably in a couple of weeks. Is that because they want to be 100% sure and they want to get all the facts together and sanitation's in place before they open their diners? What I'm specifically speaking about is restaurants. Do you believe that?
I think that supplies are limited too. So I think some business owners are finding it can be difficult to find bleach, to find gloves, to find masks for their staff if that's a policy they're implementing. So I think we're trying to be supportive in how businesses can implement it, how they can be creative about making masks or implementing, pickup and strategies that help keep customers and staff safe. I'm a business owner as well, and I know that we are still wanting to make sure might have something that makes them vulnerable if they have their immune system is compromised or are in the high risk categories, that we still can try to keep them safe. So I think a lot of businesses are still wanting to protect their staff and employees and be cautious. And like we said, testing is ongoing, and we still are gaining a picture of where we stand as a community. And I think after the next week, as we see some open up, we'll begin to get a better feel for gaining confidence in how we can open up safely. I know that we are here to support businesses as they implement the next phase. We just have recommendations and resources and just want to just be a support during this time.
Yeah.
Now, ladies, I don't have any questions on Facebook. Now, is there anything else that you would like to add? You guys have gotten to the point of COVID-19 cases and been very helpful helping businesses with guidance and material that they can use. But is there anything that you would like to share specifically to the Enid community and maybe even business owners who are a little cautious of opening up their diners?
The first thing I wanted to say is just a thank you and a praise to our health department staff. They have been getting information and direction at extremely short notice. We often have a 24-hour turnaround to implement something like the 300 tests that came up this week, and I'm just so proud of them. They have stepped up and persevered. And we're kind of getting into that phase where it was a sprint and there was some adrenaline, and now we're getting worn out. And so I just wanted to thank our team at the health department, as well as the other healthcare providers in our community. I know that they are on the front lines dealing with the same stress, but I'm so proud of our health department in particular. They've really done a good turnaround. So.
Yeah, I just want to echo that and thank all of our nurses and how great they're doing because they're testing a lot of people every day. Our phones don't stop ringing for people wanting tests, and it seems I know the community is ready to get back out there, and being at home is a whole different animal that people are dealing with, and they're frustrated too, but we're just still getting crazy news every day and having to change things, and it's a marathon, and our staff is definitely feeling it, and just want to thank everybody for how hard they're all working, and just the whole world, we're all coming together.
Yes. We appreciate business owners who have really struggled. I feel that pain that they have taken a huge hit. This is going to be a long recovery, and I just appreciate those who have kept us safe and who have sacrificed, and we're with you in the middle of all of it.
Yeah. Here to help them open up safely, and I'm ready to go to your businesses. So.
Right.
Right.
So let's keep them safe so they can stay open.
Yeah.
Yes, thank you, Maggie. Thank you, Ray, for the encouraging words and for the recognition for the Garfield County Health Department. Absolutely, they have gone above and beyond, and so thank you for the work that you're doing for the Enid community, for Garfield County. It is we wouldn't know what to do without a Garfield County Health Department like you guys. So you have definitely put the Enid community minds at peace, and so we are excited as we embark on this first phase of Mayor Pankinen's plan to open up Enid's economy. So ladies, thank you for joining me in this COVID-19 talk.
All right, thank you so much, Enid. Have a good weekend.
And for all the viewers who are watching, join us Monday for another COVID-19 live update where we will be meeting with the city. And if you have any questions, any concerns, make sure to post them. We'll be posting a post online with any questions that you may have so that we can relay to your city leaders. Thank you. Have a great weekend.